So today's June 26th, and we're going to take a look at the coronavirus outbreak, or actually now just epidemic here in Pennsylvania. I shouldn't call it an outbreak because we haven't had any outbreaks recently. Outbreaks are very localized. This has been going on, so it's even though we're in the midst of an epidemic, or you'd like to say pandemic, coronavirus is eventually going to be endemic. It'll always be around. We have right now 81,956 cases confirmed at any point in Pennsylvania. Whoops, I didn't want to do that. We have 6,579 deaths. This is as of 12 p.m. on the 26th. So today, 12 p.m. today, you can see that overall we have this downward trajectory, although there seems to be a little bit of an increase over the last few days. This could be due to opening up more, and I don't think this is due to the protests because that time has already passed, but we never know. What is encouraging to me is the low number of deaths that we have. Now, just as conjecture, it may be that we were hit so hard early that majority of the people most vulnerable already unfortunately did die, so that the people who are exposed now, especially as young people are going out, are the ones who are least likely to die from the coronavirus. So that's maybe why we're not seeing the amount of deaths that we did before. And plus we understand how to behave better, although again there are people who are not behaving correctly, and we have to watch out for those individuals and just hope that they get the message at some point so that nobody else gets sick. But that may be what we're seeing here. So that's just something to take a look at. This is the report, the weekly report on the deaths attributed to COVID-19. This was issued today. Again, I said there were 6,579 deaths in Pennsylvania up to this point. Give this breakdown by sex. Nothing really interesting here. I'm still intrigued by the proportion of deaths that are African American, as they are reaching past 22% now. That's getting higher and higher. So more of the deaths that we're seeing are among African Americans, which is, well, you say, wait a minute, the white deaths are much higher than African American deaths. Well, we have to look at it relative to the population percentage in Pennsylvania. The population percentage of African Americans is 12% in Pennsylvania, yet I'm looking at my calculator, because I divided 1426 here by 6579, and I get 22% basically. So that's way more than the population percentage of African Americans. Among Hispanics, it's lower, so I'm not really sure what that's about. In terms of the ages, you can see that the spike in deaths is around 85 to 89. So being real old, this is all deaths that have occurred in Pennsylvania, really being older, especially starting around 65 and all, you get a lot of deaths. The little asterisks here are for less than or fewer than five deaths in an age group, so they're not reported. So you can see the spike by age here. So in terms of comorbid, this is showing like where the place of death is. This is really hard to understand because of course you have long-term care facilities. That's like a nursing home. However, when people die in a hospital, they could be transported from home care or something to a hospital. So most people are going to die in hospitals when they're afflicted by a disease such as COVID-19. So this is a little bit more difficult to look at, to understand though. But there are some good interesting data, I should say, on long-term care facilities. This part is very interesting to me, looking at comorbidities. Those are other conditions one has in addition to COVID-19. This is really important. At the time of reporting, approximately 37% of deaths did not include a comorbidity. So the vast majority, 63%, did. And the primary comorbidity is dementia, which is an age-related issue, hypertension, diabetes. So that's very interesting to look at. I'll look at one last thing here, which I already did, looking at long-term care facilities. So you can see, so this is different counties in Pennsylvania and long-term care facilities. So we can see, it says reported COVID-19 positive cases among residents in these long-term care facilities. There seems to be a spike here. So does that mean that people are going out and then bringing them into the long-term care facilities again? That's not good, because that's where we saw a lot of deaths. Although it seems like the workers are doing better in not getting ill or not getting infected. So that's good. So this is employees at long-term care facilities. So this is a downward trajectory. Here we have newly identified facilities. So this is how many facilities are reporting. So I'm not going to look at that really, because I'm more interested in the individual reported deaths. So deaths are down in those long-term care facilities. So I'd say in all, Pennsylvania is doing an outstanding job, and I hope that other states will follow our practices here. But that's my report for today, the 26th at 1:17 p.m. Bye.